Good morning, everybody, and welcome. There's still people that are entering into our talk this morning, so I'll get started. It is 11 a.m, so I'll get started and I'll introduce myself to you. I know you've all been muted at the moment, and if you have any questions at any time, please write them down and I will see them. And also I will make sure that I leave enough time at the end so that you can ask any questions that you'd like that I can answer for you. I'm so happy to be here today. Let me introduce myself to you. I'm Brenda and I'm a naturopath, a nutritionist, a herbalist, and I also teach and mentor, and I was also and still am a registered nurse, and I worked at North Shore Hospital for 10 years in intensive care. So for me, I completely believe that there's a place for orthodox medicine and complementary therapies, and that both can work really well together, especially in a condition like osteoporosis. All right. Today's talk is on osteoporosis, why you may be losing bone density, and how food and nutrition can help. Now, why is my slide? There we go. So I'd like to warmly welcome each of you to my talk today, and I feel very honoured that you have taken the time to join me, and I look forward to sharing my knowledge with you. I hope you enjoy the information that I present today and that you find it helpful. What I'm also really happy to do is that if anybody would like a copy of the slides from today's talk, you are more than welcome to them. And either whether it's through me or through Dunera, we get the slides to you. It's not a problem at all. I'm very, very happy to share the information with you. My aims for today's very brief talk are to give you a brief review of what osteoporosis is, to introduce you to the reasons why you may be experiencing osteoporosis, and to explain the multifactorial picture that osteoporosis actually is. I would also like to recommend what you ideally could be doing to support your health, to explain why there is no magic pill, and excitingly to share how you can continue to have your cake, or in my case, chocolate, and eat it too. So what is osteoporosis? What we know is that our bones are always very, very busy. They are constantly turning over and remodeling themselves, and it usually occurs in a very controlled and orderly way. If we were to look at healthy bone under a microscope, what we'd actually see is a picture that looks like some beautiful honeycomb. On the left there, you can see what lovely bone, healthy bone looks like. And on the right, you can actually see what osteoporotic bone looks like, where there's not as much bone there. There are a lot of gaps in the spaces, and the bone is much, much, much more brittle, which makes sense why people with osteoporosis can have a fracture should they have a fall, or even if they have serious osteoporosis or severe osteoporosis, even coughing or a sneeze can cause a fracture. The good news, before I go any further, is that there is so much that can be done to treat osteoporosis, and you don't need to be doing lots and lots and lots of things in order to start repairing your body, helping the bone, and helping your general health. And I think that's one of the reasons why I love being a naturopath so much, because I know what is possible, I know what the body needs, and the wonderful thing is that we're not just helping your bones, but we're actually helping your entire body. Osteoporosis very simply means porous bone, and it is a bone disease that occurs when the body loses too much bone, does not make enough bone, or a combination, and therefore an imbalance between the bone breakdown and the bone formation is created. Even though we're not aware of it, our bones are busy all the time. They're breaking down, they're reforming, and we want that to continue all the time. Unfortunately, there's so many reasons why that process may become interrupted. What we can do, though, if we identify what they are, is we can put strategies in place to start trying to correct the process as much as we possibly can. The density of the bone decreases, as you saw in the photo, and they become weak and brittle and may easily break from a fall, or as I said earlier, in severe cases from sneezing, coughing, or even bending over. I love this picture. The reason that I love it is so importantly, it's what is below the surface that is so vital to helping what we see above the surface. 90% of what is going on in our bodies and in our health happens underneath, where we don't really see what's going on. And my goal is, in practice, to help people understand that and then work out what we can do so that that part of your body starts to heal and improve. This slide, I'll spend a little bit of time talking about. It's the multifactorial picture that osteoporosis is. If you see in the center circle there, I've put osteoporosis there. What I'd like to say, and as I say to my clients, osteoporosis is not the problem. While it is an uncomfortable condition to have, it can cause lots of problems. It's the symptom of things that are happening underneath the body. And our goal is to actually help all those other factors so that the symptom that is osteoporosis, which has then become a condition, can start to improve and change as much as possible. At the top there, you'll see the first writing I have is inflammation and acidity. What we now know is that inflammation drives everything. For example, daily life, poor diet, stress, ill health, all of that can create inflammation in the body. Once inflammation occurs, it creates a vicious cycle. The body becomes what we call acidic, and it creates even more inflammation, which creates more acidity. What happens is that inflammation blocks our cells from being able to absorb nutrition, release waste products, operate as well as we want them to, and without changing that picture, not by suppressing the inflammation, but by supporting the release and excretion of the inflammation and its products, nothing else in the body is going to change. And it's a driving factor. One of the biggest creators of inflammation is actually stress. And we know even in this current time, there's a lot of stress being experienced by a lot of people. What stress does is it creates the chemical cortisol, as well as others. And what cortisol does is it actually increases inflammation in the body. So therefore, what we're wanting to do is not only decrease inflammation through what we eat, and what we do, but also to support the body's stress response. It's not about saying don't stress. We know that's ridiculous and never going to happen, especially with, our life and everything going on around us. However, what we can do, which is so exciting, I think, is that we can actually help our body cope with the stress and support the stress response, which then supports the inflammatory response, which then supports the bones. The other thing is that our blood wants to operate at a certain level all the time. We call that pH. What it does to do that is it will take calcium from the bones to buffer the blood, because it must be maintained at a particular pH level, and we don't even realize that that might be happening. So in order for the body's blood to remain what it needs to, calcium is being taken from the bones to help that happen. And then later on in life, or even younger as we're now seeing, you may go for a bone scan, or you may have a fracture, and all of a sudden the body is diagnosed with osteoporosis. One of the other multifactorial components is peri and post-menopause. Estrogen is a wonderful, wonderful buffering hormone, as well as a hormone that has many, many roles in the body. And one of them is the protection of bones. So when the estrogen levels start to change in the body, that can then create the environment for something like osteoporosis, as well as being exacerbated by stress and by inflammation. What I'd really like you to remember as I'm talking about all of this is so much can be done. I don't want you to worry or freak out or anything like that, because there is much we can do, including helping your hormonal picture with peri or post-menopause. Of course, genetics does play a role. However, just because there is a genetic picture in the family for osteoporosis does not mean that you need to suffer with osteoporosis as well. Our gut and our liver are crucial. 70 to 80% of our immune system's in our gut. Our gut is the seat of all our digestion, so many functions of the gut. And if the gut is unhappy for whatever reason, that will absolutely have an effect. Then we've got nutritional deficiencies. There are some key nutrients that are essential for bone health, essential for stress support, and then essential for gut health, etc. For example, we need calcium for the bones, we need vitamin D to absorb the calcium, and we need vitamin K to lay the calcium into the bone. There are a range of different products that can be taken. However, everything also needs to come down to our diet and what we put into our mouth, because if we don't change that, we can't out-supplement a poor diet. It doesn't mean our diet has to be 100% perfect, not at all. We're all human, including myself. So I know how important it is that we have to be realistic, be able to enjoy our food, be able to have treats, and at the same time support our health. And then, of course, emotional and psychological health. In my experience in practice, we cannot underestimate the effect that our emotions and our psychological health have on our body. For example, fear, anxiety, anger, frustration. All of those cause acidity and inflammation in the body. On the other hand, love, joy, happiness, excitement, all of those are anti-inflammatory in our body. If we always remember that every feeling and every thought has a chemical reaction in our body, it goes a long way to working out what we could maybe do to help our body through that aspect as well. Before I go further, I'll just check to see if anybody has left me a question at the moment. If you have any questions right now, please write them in so that I can answer them for you. So I've got a question now. Could you discuss osteopenia and its connection to osteoporosis? Not a problem at all. Osteopenia is I like to say, the precursor to osteoporosis. So with osteopenia, it's telling us that your bone health is needing some work, that your body is needing support, and if it's not addressed, it can then move on to osteoporosis. All right, let's continue. Eating for your bone health. In my experience and from what I know, it is not complicated which foods need to be avoided and which foods can be enjoyed. The challenge is being motivated and compliant and knowing that it is a long-term lifestyle change. That sentence, motivated, compliant, and knowing that it is a long-term lifestyle change, I think is one of the most important sentences of today. Why I say that is, what we eat needs to be for the long term. It doesn't mean we can't have treats. It doesn't mean we can't enjoy our food. The quick fix does not work. If we understand from my previous slide that inflammation, acidity, stress, etc., all play a role, gut health, etc., what we're looking for is a lifestyle change that supports and nourishes and treats all those factors to then give us the long-term result of better health and better bone health and preventing osteopenia from even becoming osteoporosis. Motivation is so important. Knowing we're all human, it can go up and down. And what I say to clients when they fall off the wagon is it's okay. It will happen. However, no need for guilt, because guilt actually creates more inflammation because it's a stress reaction. And all we need to do is get back on the wagon and start again. The wonderful news is that I believe that we can, as I've already said, enjoy a treat every day, because it is not to be a diet of deprivation. All that will do is cause stress, non-compliance, and have you running for the hills because it will all feel too difficult. If you suddenly decide you're going to stop eating a particular food, that can be a shock to the body. And while intellectually we may know that sugar's not good for us or good for our bones because it creates inflammation, the body has set up a pattern where it may have become addicted to it. And as we support the body, the adrenal glands, the stress response system, the thyroid gland, the gut, the liver, etc., it will become naturally easier to stop the sugar because your body will no longer want it. Say, for example, a client sits in front of me and they say they put 3 teaspoons of sugar in their coffee. If we can go down to 1.5 teaspoons, that's a win. Then we can go down to 1 teaspoon, that's a win. as we are working on supporting everything so that the body doesn't go into a state of shock and your motivation and compliance remains more consistent. I'll just have a look at some questions. There's an annoying window. I'm so sorry about that, Anna. I'm not sure how to remove that. I think it comes up when someone's either entering the room or I'm going to look at questions. I hope that makes it better for you. Will this be recorded and available? Yes, I believe it is being recorded and will be available. And as I said earlier as well, I'm not sure if you were in at the beginning, you're all more than welcome to have a copy of the slides. I'm very happy for that to happen. Vitamin K1 we'll talk about in just a moment, and it's important for the calcium absorption into the bones. Can I advise a good combined calcium and vitamin D supplement? Is Caltrate good? I would prefer today not to talk about those sorts of things. I don't mind if you, I'll speak with Dunera about how questions can come to me so that I can talk with you about those. And then I'm not allowed to actually mention different brand names or supplements at the moment, but I'd like to be able to help you, so I need to work out how we can do that. Another question, is it very important to have a bone density scan? The answer to that is absolutely. If you've never had one before, and you have entered menopause or even are at perimenopause, I always recommend going to have a bone density scan. The reason for that is we want to know what is your baseline. We can then devise a program that is tailored for you that will then help you get the best results. We want to know what's the calcium in your bones like and how much bone mass, bone density do you have. We can then later on repeat the bone scan to see the progress of your treatment, your dietary changes, etc., so that you can monitor what's going on. So it is absolutely essential. All right, I'll come back to some more questions shortly. As I said, here's just that slide of what I said before, that some days will be easier than others. There will be times that you fall off the wagon. It is absolutely okay. All you need to do is remove the guilt, get back on the wagon, work out why you fell off, and work out strategies that may prevent it in the future. I have to share and say that when clients come to see me, I'm very happy when they've fallen off the bandwagon. The reason for that is I believe there's nothing like personal experience to guide us, educate us, and help us with our compliance and our resilience. When someone falls off the wagon and they notice particular symptoms coming back, for example, bloating, fatigue, sluggishness, constipation, all the things that are actually very important for bone health, and they go back and they're able to see what was it that they ate, what was it that they did, I think it's really empowering, because I can tell you all these things, but there's nothing like personal experience. And that's another reason why I'm always really happy when people tell me they've fallen off the wagon, because it's usually a very educational experience. All right, what are the general guidelines for eating for bone health? What we always want to do is reduce and avoid the foods that increase inflammation. The most important foods Naturopathically and nutritionally to avoid include dairy from a cow, goat can generally be well tolerated, red meat, particularly steak, sugar, including dried fruit, wheat or gluten. Some people it's only wheat, for other people it's all gluten, which includes wheat, and alcohol. One of the foods I didn't put there, or beverages, is coffee. The reason for that is that it is very important to reduce it, but I don't put it down there because I prefer to have a little bit of a chat around coffee as well, because for so many people, coffee is a ritual. And when I said before, it's not about having a diet of deprivation, I always allow or recommend to clients, it's okay to have a coffee a day. It comes down to how many you have and when you have it. The ideal time to have a coffee is at morning tea time. If you are having it first thing in the morning when you wake up to get yourself out of bed and going for the day, that tells me that your stress response system and your adrenal glands are very tired and you're needing the caffeine to give you the kickstart that you need. What we would ideally want to do is help fill your petrol tank in a different way and have you enjoy your coffee at morning tea time, ideally without cow's milk. Some almond milk is absolutely fine. If it does have to be cow's milk, it's the only time you have it. And I prefer and I recommend not soya milk either. With red meat, for some people, red meat is very important to them, no problem. What I generally say then is please avoid beef. It is very difficult for the body to digest in most people, and it is very, very inflammatory. If you are going to have some red meat, some lamb would be a better choice. And of course, we always talk about sugar. Sugar is so inflammatory to the body. It is so fatiguing to the body, unhealthy to the gut, and we are all so addicted to sugar in our country and in fact all over the place. The reason I say dried fruit is because dried fruit is such a concentrated source of sugar. All the moisture, the water's been removed, and very few people in my experience chew dried fruit enough. So this amount of sugar is going straight into the gut, where in many people it sits there and ferments, creating things like bloating, wind, constipation. While it is very difficult to avoid all sugar, there are healthier options of sugar. For example, instead of regular white sugar, even switching to brown sugar is a win. Coconut sugar is a better choice. Rice syrup is a much better choice. So no matter what we remove, there is always an alternative to give you that sweetness that you will be looking for. If somebody has, for example, a block of chocolate, let's go to half a block of chocolate. That's a win. And instead of milk chocolate that has dairy and sugar, dark chocolate. So as you can see, there is always something that we can do. People always ask me about alcohol. In the ideal world, when we are helping reduce inflammation, acidity, and trying to get the body to start changing its blueprint to be better again, even alcohol, 1 glass could be too much. Ideally, we would stop it at least for a month. I know that can be very difficult. So then we work with, well, what is possible and what's not possible? And instead of having beer, for example, you may be better off having a spirit. Instead of wine, you may be better off having something else. Everybody has a different response to things. What we want to do is enjoy and love the foods that decrease inflammation. They are our fresh vegetables and especially plenty of leafy greens. If there's one thing you take away from today, I would say please add leafy greens to all your meals every day, particularly to a lunch or to a dinner, even to a breakfast if you're that way inclined and you like to have eggs. They're so important. And I think, unfortunately, we just don't eat enough, and yet they're so easy to have. Oily fish, including salmon, mackerel, sardines, nuts and seeds, including hemp seeds, sunflower seeds, pumpkin seeds, delicious and wonderful chia seeds and sesame seeds, and of course, olive oil. So what is an example of a delicious day of food? Before I go there, let me have a look at, I can see some more questions have come in. All right, where was I up to? I am 80, do I need bone density? Absolutely, yes, yes. I think that I am of the belief system that even though our birth number increases, our body can still be healthy. Changes can still be made for the better. Our bodies, I believe, really want to be well. And all we need to do is give them the correct information. It doesn't matter how severe your condition is, there is always room to feel better and to have more vitality, to have a better feeling within yourself. Another question, once bone density is badly lost, can it be built up again? In my clinical experience, I have had clients who have been able to rebuild their bone from osteoporosis or from osteopenia, of course. The challenge comes down to how severe it is, what underlying conditions they have, what they're willing to do, how compliant, and how much time we've got to work with. Even if we're not able to fully recover the bone, there is a lot that still can be done to improve the bone health, and that's really important to know. I know that many people with osteoporosis are on different medications. I am absolutely okay, and we in our naturopathic world and nutrition world are all okay working with whatever medications you are on, whether they are just for osteoporosis or you're on other medications for other conditions or anti-inflammatories, etc. So even it's a wonderful way that the two worlds can work together. Monk fruit as a sweetener, not a problem. Enjoy, that is fine. You don't need very much at all. Maple syrup. I'm a big fan of maple syrup. However, when we are, sorry about the however, when we are starting a process like treating osteoporosis, the maple syrup is too high in sugar. So it would be something that initially I would recommend you avoid and use something else. and then eventually bring small amounts in. As you start to change within your body, what you will generally find, and what I find happens consistently in practice, is your desire for the sweetness totally changes. And whereas before you may have thought a teaspoon was sweet, now you may find even a quarter of a teaspoon is too sweet. So everything adjusts and changes as we improve things in the body. Tomatoes and eggplant, the nightshades. I didn't put those on, and I'm so glad you mentioned those. Thank you. I recommend not having them, particularly tomatoes. If there was one food out of the nightshades of tomato, eggplant, capsicum, potato that I would say you need to consider avoiding first, it's tomatoes. Raw, and in many cases cooked. The reason for that is they are so acidic and the bones don't like them. The gut may not like it either. And by decreasing and avoiding the tomatoes, you're taking a huge acid load off your body. In some people, they're able to tolerate cooked tomatoes or tomato paste. Not everybody is. How do I get enough calcium if cutting out dairy is another question? I've got a slide coming up, Nikki, on that, so please hold on and I'll get right to it. Another question, is lemon or vinegar too acidic for someone with reflux or hiatus hernia? The answer is no, it needs to be the right vinegar. So, lemon, even though it's a citrus, is alkalizing to the body, and that's what we want. It comes down to the amount you have. Even a slice of lemon can be very beneficial. With the vinegar, it must only be, please, apple cider vinegar. White vinegar, brown vinegar, balsamic vinegar, none of those vinegars. Apple cider vinegar is also very alkalizing and can be very effective for many people who do have reflux. I'll come back to more questions shortly. So on waking, as I've written there, a quarter of a lemon or a half to 1 teaspoon of apple cider vinegar in a glass of warm water first thing in the morning is a wonderful way to start the day. The reason for that is it kickstarts digestion, it flushes out the liver, and it helps with bowel movements as well. We do our detoxing at night when we're sleeping, which is also why sleep's so important. And you'll find if you've got a lot of inflammation, people often have very interrupted sleep. So when you have the lemon or the apple cider vinegar, what it's doing is it's helping flush out the waste products from the detoxing processes through the night and kickstarting our digestive secretions and helping the body get started for the day. One of the things I always remind people though with lemon is lemon can soften tooth enamel. So please do not brush your teeth half an hour either side of having lemon so that you do not damage your teeth in any way. With breakfast, I've just put up a couple of options here. There are many, many more. These were just a couple with our time. 1 to 2 eggs with avocado, spinach, and 1 to 2 slices of wheat-free toast. You'll notice with the meals that I'm putting up that every meal for good health, what we're wanting is to have a combination of protein plus healthy carbs plus healthy fat. Our bones need healthy fat as well as protein, as well as healthy carbs, generally from our vegetables. One of the things that we have to always be aware of with bone health is muscle health, which is where protein comes in as well. In order to help our bones, we need strong muscle. I know that as people get older, the amount of muscle can start to decrease. What we need to do is to preserve our muscle for as long as possible and make it as strong and healthy as possible, because that will absolutely support our bones. The other thing is that protein is always acidic. There are some protein sources that are not as acidic, but there is always acid in protein. Therefore, to alkalize that protein, we need our green vegetables. We need our alkalizing vegetables. And to support the absorption of everything and the utilization of everything in the body, we also need to have our healthy fats. What is a healthy fat? A healthy fat is avocado, olive oil, coconut oil, nuts, seeds. Those are oily fish. Those are very good examples of healthy fats. Another option for breakfast could be oats porridge, as long as your body's okay with oats. Sometimes you could have a quinoa porridge, millet porridge, etc., served with almond milk. If you don't like almond milk, you could have another nut milk or oat milk or goat's milk. I find goat's milk, you either like it or you don't. It's very strong, and some people are totally okay with it, others are not. And then you can add nuts and seeds for some added protein and healthy fats, and you can have some berries, which are optional as well, frozen or fresh, that doesn't matter. Let me move the slide. Morning tea time. Morning tea, as I said earlier on today, is the absolute ideal time to enjoy your coffee. You can also have one piece of fruit if you're able to tolerate fruit, or you could have 8 to 12 almonds, for example, or some other nuts as well, not a problem at all. You could have some hummus if you wanted to, with some vegetable sticks, which I've put in for the afternoon tea snack. There are lots of different options that we've got, but what we're wanting to minimize are protein bars that have lots of sugar in them, all those sorts of things. For lunch, especially in winter, soup could be fantastic, or leftovers from dinner the night before, or salad and vegetables, plus a protein source that could be eggs, fish, chicken, or tofu if you're a tofu fan, or even beans, as long as your body tolerates beans. Not everybody's body tolerates it, and therefore it's there if you're able to have it. Afternoon tea could be almonds, or it could be the vegetable sticks with hummus or tahini, or it could be gluten-free crackers with nut butter. What you're seeing there is there's protein with every option that I've given you. Hummus is chickpeas, which is protein. Tahini, being sesame seeds, is protein. One of the things that many people experience in the afternoon is the energy slump in the afternoon, particularly around 3 o'clock in the afternoon. One of the things that can help offset that from happening is by having a protein snack around 2:30, 2:45. Once the hunger or the slump hits, that's already telling us your body's a little bit unhappy and we don't want it to actually reach there. So what you could do is have a snack or even a protein smoothie if you wanted to beforehand, so that you're actually preventing the slump from happening and giving your body the added nutrition that it needs. The other reason that it can happen in the afternoon is dehydration. If you're not drinking enough water through the day, by the time you get to the afternoon, your body is thirsty. I'd just like to say here that water on its own can be very difficult for the body that's inflamed, overwhelmed, and fatigued to absorb. You may find that you drink water, but that you go to the toilet a lot to urinate. And one of the reasons that's happening is because the water's literally going in one end and straight out the other. What we need to do is put something into the water to help you absorb it into your cells. Lemon in water does that, for example. Apple cider vinegar can do that. A tiny pinch of sea salt can do that if you're able to do that. Magnesium powder can do that. An alkalizing powder can do that. So it actually helps your cells absorb the water. One of the things you'll notice first is that you then won't be going to the toilet to urinate as often because your cells are actually absorbing the water. With dinner there, again, vegetables plus protein, and this is where you can also have a little bit of rice or quinoa if tolerated, and if you'd like to have it, or some gluten-free pasta if you wanted to have, but it comes down to the amount that you have. I love chocolate. Anybody who knows me knows I love chocolate. I love cake. It comes down to the type you have and when you have it. I'm absolutely okay with every single one of my clients enjoying some dark chocolate after dinner. Not dessert, not fruit, not ice cream, none of those foods that can really impact the body before you're going to bed, but a little bit of dark chocolate, 70% or higher. And as I say to my clients, and as I say to myself, enjoy, 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 enjoy. Okay, now here, this slide is some food sources of the important bone nutrients. And in answer to your question earlier on, some non-dairy sources of calcium include almonds, broccoli, buckwheat, egg yolks, green leafy vegetables, sardines, and soybeans like edamame. So not soya milk, but the soya beans, some edamame. I'm a big fan of eggs. I know that people get very concerned around their cholesterol and eggs. I'm very happy to talk another time about cholesterol and how important it really is. So if you're happy to have some eggs, I encourage you to enjoy them and allow the nutrition that's in there to help your body. Vitamin D, needed for the absorption of calcium, which we get in our fish liver oils, like cod liver oil, for example. It's also found in egg yolk or in sprouted seeds. In my clinical experience, most people need a vitamin D supplement. Unfortunately, with our sun and the severity of it, we're not able to get enough generally from the sun, and there's also a large percentage of the population that genetically are not able to effectively convert the vitamin D to its active form from the sun. So I generally find, and particularly in winter and the colder months, that having a vitamin D supplement is very, very important. Vitamin D is not only needed for the bones, it's needed for everything from immunity, brain health, gut health, thyroid health, everything. Now, vitamin K. So we need vitamin K to lay the calcium in the bone itself. Some very good food sources there are asparagus, broccoli, cabbage, eggs again, kale, kelp, lettuce, liver, oats, soybeans, and spinach. I'm a huge broccoli fan, and it's absolutely okay to enjoy it every day, to have some spinach, some kale, however, whatever you enjoy, but those green leafy vegetables are so important. Now, magnesium, as I mentioned before, was anti-inflammatory and needed for bone health, and that it also, supports the stress response. And magnesium from food sources are found again in things like almonds there, barley, eggs, cacao, figs, kelp, leafy greens. I'm not reading everything out, I'm just picking a few things, and seeds. And magnesium is essential. And in my experience with clients, most people, unfortunately, are deficient in magnesium because it is so important for so many things. Let me have a quick look at some questions to see what may have come up. Thank you very much. Does dairy food not help with bone health? From a nutritional aspect, we look at dairy very differently to the medical world. And for us, our belief, and from what we know, is that dairy is not, the calcium in dairy is not very well absorbed or utilized. It's also not in all the correct ratios with other minerals. So we look at other sources to get calcium for bone health instead of cow's dairy. Also, in my experience, a lot of people are intolerant to the protein that's found in dairy, and by removing it, they start to notice a huge improvement. Even things like sinus problems, digestive issues, in children with glue ear, all those sorts of things. Dairy is very mucus forming as well, so it can have other effects. Another question was, is oranges and bananas? Thank you. Oranges, I generally recommend coming off oranges. They are very acidic, especially if you've got reflux problems, gut issues. They have an acidic effect on the body, not an alkaline effect like lemons or limes. Bananas are fine as long as you don't have mucus problems, or we're wanting to avoid all fruit in the initial stages. But if you have colds, flus, all those sorts of things, banana is very mucus forming, and avoiding them can make a big difference. Repeating about the teeth with lemon, no problem. Lemon can soften enamel, so please don't brush your teeth for half an hour after you've had lemon. And a good idea as well is to drink the, I didn't mention this before, but to drink the water with the lemon. You can use a metal straw if you wanted to, so that it's not touching your teeth too much. Or if you don't want to use a straw, rinse your mouth out, put some regular water in, and then just swish it around and swallow it, so that we just remove the effect of the lemon on the teeth. Tofu is not as acidic as meat. Mineral water. Mineral water is an interesting one. When I start working with some clients, there are people who say to me that they struggle to drink water because they don't like the taste of it, or it just doesn't appeal to them. Are they able to have mineral water? I will often say yes, unless there are particular gut reasons why I think it's not a good idea. but plain mineral water that you can then flavor with a little bit of lemon or lime or mint or cucumber, even some celery in there, while we start the initial process. But having a lot of mineral water is not good either. Dark chocolate late in the day can keep me from getting to sleep. That does happen in certain people because it can be a stimulant. So that can happen in some people. So if that's the case, what you're needing to do is avoid it, and some magnesium would also be very good. As I said about the calcium earlier on, I don't want to use today to recommend any supplements. I'm not able to recommend particular brand names. So I'll speak with Dunera about what we can do around that so that I can also help you make good choices when you're choosing your supplements, because there is a big range of what supplements are available. Some are good, some are not good, and some, of course, are better. How many eggs a day can one eat? 1 to 2 eggs a day, I believe, is absolutely okay. Why do we need to avoid cow's milk? I hope I've answered that question already by what I said previously around the protein in it. I know some people react to the lactose and they use lactose-free milk, which is the sugar in milk, but a lot of people react to the protein. The way that I describe cow's milk to my clients is that the protein in cow's milk, if you imagine it's like a square and our body is like a circle, and you're trying to fit a square into a circle, and it's just not a good fit, and it creates potentially a lot of problems in the body. Goat's milk is a better fit to cow's milk, or even sheep. Sheep's yogurt, goat's cheese, halloumi cheese, all those sorts of things are okay for you to enjoy. Magnesium tablet or powder, which is better? Generally speaking, it comes down to choice. If we understand that compliance is everything, it's what you feel you're going to be the most compliant with. However, if your gut is very unhappy for whatever reason and needing to be healed, generally a powder will be absorbed better because the tablet still needs to be broken down to be absorbed. So that's where a difference might come into it. Kefir, you can have kefir if you'd like. However, it does not agree with everybody. So it comes down to seeing how you go, avoiding it and seeing what you notice, and knowing whether you're then okay or not okay. If you love cheese, goat's cheese, as I said a moment ago, is fine. Halloumi or feta, sheep's cheese as well. It's just the cow's cheese that I, as a nutritionist and naturopath, would recommend you don't have. If taking a combined calcium and vitamin D tablet, how many times per week would you suggest? With the products that I use, it's daily. It comes down to what your body's needing and what you're using. If you have something acidic, can you eat or drink something after to counter it? I love that question. That's a great question too. Thank you so much, everyone, for all your questions. Yes, the aim, which is why with meals, I always like people to have something alkalizing with it. For example, as well, if you're cooking some chicken or some lamb, and you're concerned with how you're going to digest it and you'd like to make it a bit more alkaline, what you can actually do is start the digestive process for it by actually squeezing some lemon onto the meat, particularly red meat, because that will already start to break it down and make it a little bit easier on your body. If you're then having your alkalizing vegetables as well, that will make a big difference. Generally speaking, the way that we work with helping to alkalize the body is by giving you alkalizing powders to take, because they have a greater overall effect for alkalizing you. But certainly adding the vegetables, etc., to your meals, some lemon, some lime, can help to counteract it. All right, let me continue. I've just looked at, oh my goodness, I'm so sorry. I've just looked at the time and it's 12 o'clock. I've been on such a roll. I'm so sorry, everybody. I just wanted to make a note of lifestyle as well, because we all know that weight-bearing exercise is needed to maintain adequate bone density and strength. And you may need to be given a program by a physio or an exercise physiologist or a personal trainer, so that it is absolutely specific to your needs. What works for one person may not work for somebody else. If you are a smoker, please, I would ask you to consider giving it away, or certainly decreasing, because of the inflammation and the toxicity that it creates in the body and the effect that this can then have on your bones. Why there is no magic pill. In my clinical experience, unless the underlying issues are addressed and treated, the body will not heal as much as it potentially can. Our bodies, as I said earlier today, want to be well, and they can remain healthy as we age. They do not need to slide into chronic ill health as we get older. But in order to have great health, things need to be addressed, and it does take time and effort. But as I've noticed and seen personally and in practice, wonderful rewards are possible. Some points to take away with you. The reasons you are experiencing your current symptoms and conditions are often many and usually all interrelated, as I hope I was able to explain in that earlier slide today. Inflammation is a key driver, and it is absolutely essential to treat it and not just suppress it. If all we are doing is suppressing it, where's it going? It's still there. The lid has just been put onto it. We want to remove it. Natural therapies, nutrition, herbal medicines, etc., can offer strategies to help you with your health goals. Diet and lifestyle are crucial. Osteoporosis cannot be treated by supplements or medications alone. And as I said before, supplements can work alongside your medications. And compliance is everything. If you want to be as well as you can, you need to do the work. I know that myself as well. However, it will not take long to start to notice changes in your body as you make the changes. I'll thank you so much for watching. I've got my chocolate ready to go while I have my weight in my hand, building my muscle. And I'm going to enjoy a piece of my mint dark chocolate once I say goodbye. Thank you so much for your joining me today. I hope it was interesting for you. And as I said, you're welcome to the slides. And I hope you have a lovely, lovely day. Bye-bye.